Hi, Mr. Phan.
Yes, hi.
Hi, I'm Jennifer. I'm a physician
Nice to
assistant.
meet you.
What brings you in today?
Hi, I'm his wife.
Hi, nice to meet you.
I actually hurt my wrist.
Yeah, he hurt his wrist the other day.
Okay, and how did this happen?
He actually fell down the stairs.
Yeah.
And he tumbled all the way down. And he said he heard a crack, and now he's just been in pain.
So you heard a crack when you fell?
Yeah,
Yeah.
he heard a crack.
And on a scale of 1 to 10, how's the severity of it?
It's
Probably a 2.
Yeah, it's not.
Yeah, I don't think it hurts.
It's not too bad.
Okay, Mr. Phan, it doesn't hurt too bad?
No.
No, it doesn't hurt so bad.
Mrs. Phan, I really appreciate your questions. I understand you care, but it would make my physical exam so much easier if I could just let Mr. Phan answer these questions. Is that okay?
No. Can't you see? I'm his wife. And I just told you what happened. He hurt his wrist. He fell on the stairs, and he heard a crack.
I understand you really care, but I really want to make an accurate diagnosis, and I'm sure you want your husband to get better. So if he could just answer questions, that'd be amazing and very helpful. Thank you. So Phan, does the pain radiate down your arm or through your hand or fingers at all?
Yeah, it goes up here a little bit.
Can't you just see he broke his wrist? We just want to get a cast and leave. He heard a crack. You see a bruise. It's broken.
I understand that you're in a rush, and I'm sure you had to wait in the waiting room, but I just want to get a full history, that way I can make an accurate diagnosis. But I am ready for my physical exam now. If there's any way that you could step out of the room, just so I could do a comprehensive exam and get an accurate diagnosis.
I don't think it's necessary.
Hospital protocol says that as an adult, I have to do a physical exam on him alone, and it would really help with my diagnosis.
Well, I'm his wife, and I think I should be here.
I know you care about him and you really want him to get better and care about his wrist, but it would make the exam much faster, which I know you're in a rush, and it would give me a better chance to get an accurate diagnosis.
Is it really that necessary?
It really is. I'm sorry. I know you want to stay with him and you care about him.
Fine.
Hi, Mr. Phan. Before we do the physical, I just want to go over your history again now that we're alone. If you want to take a seat right in this chair for me, we can just have a quick conversation.
Alright.
Oh, how bad is the pain in your wrist?
It's not so bad. Whatever my wife says is actually what happened.
Is that how it really feels, or?
Yeah. Yeah,
Okay.
I guess, yeah.
And how did that happen again?
I actually tripped and broke the railing of our staircase and just fell down a couple steps.
You fell down a couple steps?
Yeah, a couple steps.
Oh, your wife said you fell down the full
Sorry. Whatever. Yeah, I fell down the whole staircase.
Are you sure? Did your wife witness your fall, or?
Yeah, she was there actually the whole time.
Okay. And how are you and your wife? Do you guys fight at all, or?
No. We're high school sweethearts. We never fight. We have I think a perfect relationship.
Perfect relationship?
Yeah.
Okay. And so when you argue, it's just normal fighting?
Yeah. I guess when the kids are in bed and we're alone, it's just normal. Whatever couples go through, that's what we go through.
So are you afraid at all? No physical injury at home?
Yeah. I'm not afraid of her. We're fine. Yeah.
You're fine?
Yeah. I'm fine.
We have a confidentiality policy, so you can feel free to tell me whatever you need. I'll be here for you if you ever feel like talking about anything.
Okay. All right.
So I'm just going to ask you one more time just to make sure. You feel safe? Are you okay, Mr. Phan? Do you need a tissue?
Yeah.
It's okay.
Me and my wife, ever since high school, we played to love each other. She wasn't like this in high school. She was so sweet. She was like our high school cheerleader. Oh man, it just started a couple years ago. Cause she suspected me of cheating on this one girl, but we were just friends. It was actually just a coworker. She's been blowing things out of proportion. Every girl I meet, she thinks I'm cheating on her with them, and the abuse is getting worse lately. My son actually saw everything yesterday.
Thank you so much for sharing, Mr. Phan. Exactly how does she abuse you?
It was verbal a couple months ago, and now it's gotten physical. The whole staircase thing, she actually pushed me down the stairs.
Oh wow, that must be really hard for you. Really hard for you to share. When does she abuse you? Is it out of anger, or?
Every time I got home, and whenever she hears a call at the dinner table when my boss is calling me, she thinks a girl is calling me just to check up on me, but that's not the case. It's just all work.
It must be really hard for you. I've actually dealt with this before because my mother was in an abusive relationship. So if you want, I can give you some strategies in case you ever want to leave.
But I love her so much. Like, we've been together for like 10 years.
This is just a preventative measure just in case you ever feel endangered or you need to leave. Would you like me to give you the paper? Here's the number for the Safe Horizons hotline. You can always call them if you ever need to talk. I also put my phone number on there because I'll be here if you ever need to talk also. Have you tried to talk to any family members about this?
No, I'm just too embarrassed. I'm just embarrassed. Like, guys don't get hit by their wives.
I see a lot of domestic violence cases come through my office, and it's both male and female. I just want to go over what you told me before. Your wife started to get angry with you and started to become abusive with you a few months ago, and now it's become physical. Is that correct?
Yeah, it's gotten a lot worse. My son actually saw the last incident that happened.
Is your son okay?
Yeah, he just ran up and started crying in his room.
Do you feel unsafe at all?
Yeah, I think my wife actually's gonna start using maybe a gun or something. She's been like trying to get a gun lately, so I don't know what's going on.
Do you want me to go over the safety measures with you?
Yeah, just for my kid's sake and everything.
Okay, so one of the measures we tell our patients is to always keep a bag packed with your license, your social security card, some money, definitely identification, and you want to keep your keys near the doorway, and you never want to be in a room where there's no doorway, just in case.
What happens if the door is locked or something? Is there another option for that?
You want to make sure that you have escape plans, so if you feel like she's getting angry, try to just head towards the door and make sure it's unlocked, or just keep some keys in your pocket. You always want to make sure that if anything happens, you can get out quickly.
Do you think I should get like certain documents out of the house and just leave with like a neighbor or something?
Yes, you probably want to get your son's birth certificate, just in case, and any identification for him also.
All right, thanks, doctor.
You're
Thanks for
welcome.
everything.
And I want to schedule a follow-up with you, hopefully in a couple weeks. Would that work for you?
Yeah, hopefully it doesn't get worse.
And my number's on there. Call me if you need anything.
All right.
And I will, if you want to make an appointment with my secretary, and I'll see you in a couple of weeks.
Okay.
Hi, Mr. Phan. How are you today?
All right, nice to meet you again, Doc.
Who's this little guy?
My son, Abul.
Nice to meet you, Abul. How are you today?
I'm good.
Good. How have you been doing since we last met?
It actually got worse from my wife. She went crazy. You can't tell what happened. Well, I actually follow your safety plan and work a lot. We called the cops and now we're just separated. So we're so glad how you helped me last time.
Do you feel safe now?
Yeah, I'm just glad me and my son got out of the house. She was getting crazy. She was wielding a gun, and actually, thankfully, she didn't fire any shots towards my son.
I'm really glad you were able to get out. That's
Yeah.
what we really want.
Thanks a lot for all the advice. I actually called the helpline. It helped a lot. We actually went to like supportive care now, me and my son, with other families that was affected, and now hopefully we can resolve everything now. And
Good. I'm really happy you got out safe and you can return to your normal life and you have your son with you. That's really good.
Thanks a lot, Doc.
It was really good seeing you. I'm glad you had a happy ending.
Thanks a lot.
Hi, Mr. Phan.
Hi, nice to meet you.
I'm Jennifer. I'm physician assistant.
Hi,
And who are you?
I'm his wife.
Nice to meet you. So what brings you in today?
My wrist.
He actually hurt his wrist the other day.
Okay. And on a scale of 1 to 10, how's the pain?
It's probably
It's
two.
actually
It would-
Two. Doesn't hurt that much.
How would you know if it hurt?
Yeah.
You should let him answer the question.
I'm his wife. I know everything about him.
Do you know what pain he's feeling right
Yes,
now?
I know everything.
How do you think I'm going to diagnose him if you answer all the questions?
It's your job. You're a doctor. You should be smart enough to diagnose him.
I could if you didn't interrupt every 5 seconds. Okay, I'm going to start my physical right now. Mrs. Phan, if you could just leave the room so I could do that.
I don't think that's a good idea.
I think it's a good idea. I know you hurt your husband. You need to leave.
You don't know anything, and I'm not leaving.
Yes, you are. I'm going to call the police.
Fine, I'm taking my husband with me.
So how's your relationship with Mrs. Phan?
It's perfect. I love her so much.
Are you sure she doesn't hate you?
No.
Did you do anything to make her hate you?
I just go to work. I don't do anything.
Well, I know she hits you. Why don't you leave her? What is wrong with you? You're gonna get hurt.
I love her so much.
How could you love someone that hits you? You have a son. You need to leave now.